Joining us now via Zoom is Sheri. And Sheri, we have our LA correspondent, Dr. Andrew Orden, who you know, who is with me in studio today.
Hi. Hi, Dr. Orden.
Hi, Sheri. So good to see your face. I've missed
you. Good to see you, too.
And you look wonderful.
Oh, thank you.
But, you know, our hearts really go out. You have been through so much, and we all wish you the best and are thinking about you.
Thank you.
You know, Sheri, you actually received a big shock after your surgery. What was that?
Well, it turns out that I had DCIS in situ in the right breast and invasive ductal carcinoma in the left.
So let me just be clear, because those are some big words here. So
yeah.
you basically went in as a preventative measure, and then after they're removed, you then get the news that both of them had some stage of cancer in them, both of your breasts.
Right, correct.
And how did that make you feel? What did you think?
It was a shock. It was, I didn't expect it at all. The doctors didn't expect it. I was expecting to have my pathology come out clean and look wonderful. And then all of a sudden I'm faced with this, okay, what do I do now?
So Sheri, I want to introduce your mastectomy surgeon, Dr. Heather Richardson, and reconstructive surgeon, Dr. Lisa Cassileth. So overall, how do you think Sheri's surgery went?
I was thrilled with the surgery. It was textbook surgery. I think that Sheri probably lost more blood when she had to have her blood drawn for her pre-op testing. It was just really kind of a perfect scenario. The tissue came out really cleanly, easily. And again, we did all of our due diligence to make sure that there were no signs of cancer in her breasts before we proceeded with the surgery. And it was a complete shock, complete surprise to all of us.
Well, Dr. Richardson, is it unusual to find cancer after mastectomy when you didn't diagnose it beforehand?
Very, very unusual. It's less than 2% of the time do we find anything.
And as surgeons who do breast surgery, I mean, we have to expect the unexpected. I know I just recently did a elective breast reduction, and the path came back with DCIS, a diagnosis of cancer. Obviously very difficult to explain that to the patient, but you know, that's why we're here. That's why we work as a team. The two of you do all of your work together, and I think that's one of the big take-homes today is if you have breast cancer, if you have an issue with your breast, you want a team of the oncologic surgeon with your reconstructive surgeon, and I know you two do wonderful work.
Well, Dr. Cassileth, I want to ask you, you call this a direct-to-implant surgery. So can you explain to everyone what that is and how it's different than the traditional mastectomy that women undergo?
Well, with direct-to-implant, both parts, the mastectomy and the reconstruction, are done in one surgery. So the first half of the surgery, Dr. Richardson does the mastectomy. Then I come in and do the direct-to-implant, so the final implant, at that time, at that same surgery.
And how long is the total procedure from beginning to end?
Well, each mastectomy takes her about 1 hour aside, and then the reconstruction takes me 1 hour aside. So considering the overlap, it takes roughly 3 hours to have the reconstruction and the mastectomy.
Awesome. And now, Sheri, you have the pathology back. You found out that there was cancer in both breasts, according to the pathology report. What's next for you?
Well, next I'm not sure because chemo is being suggested, but right now there's no evidence of cancer cells. I mean, it's taken out with the tissue. So it's very confusing, and I'm really not sure what to do right now.
Well, Sheri, I want you to stick around for the next segment. We're going to talk about that. Dr. Richardson and Dr. Cassileth, great job, by the way, complete pros. We appreciate you giving us that great information.
Oh, thank you.
It was great working with Sheri. She's a great patient.
I feel like it was the luckiest thing in the world, in a way, we found this pathology, because if you hadn't decided to proceed with surgery, that cancer would be in there growing now. We caught it early, we caught it small, and you have the luxury of making a decision for the tiny advantage to even want chemotherapy. We would not be in this situation had you not decided to go ahead with surgery.
Very, very well said. So, Sheri, you stay there, and thank you, doctors, for all your work.
Thanks, Doc.
Thank you.
Thanks, you guys.